I'd now like to introduce our next speaker, Sonia Hawea, who's the Chief Executive of the Taikura Trust. This is a charitable trust contracted by the Ministry of Health to provide eligibility screening, assessment, service coordination and budget management for disabled people under 65 years old living in the Greater Auckland region. And the Taikura Trust supports over 12,000 people. Sonia joined the Trust not long after it was set up in 2002, and she came from policy and regional development roles with Te Puni Kokiri, and prior to that she worked as a researcher on treaty matters and health issues. So, kia ora.
Tēnā koe, Catherine. Tuatahi he mei poto tēnei ki a koutou katoa, ko taimai nei tēnei ahihei. Kia koe e te matua binta mō tō karakia, kei wanganui a tātou i tēnei ahihei tēnā koe mō tērā. Huri noa ki ngā kārangaranga maha o tēnā rohi, tēnā tātou katoa. That's a tough act to follow. I'm definitely not going to sing. Kia ora, Bentham. Okay, towards inclusion. I guess the essence of just picking up on Catherine's introductory comments and some of the questions she's picked up on over the course of the last day and a half, one of the messages that I have underlying my kōrero today is don't throw the baby out with the bathwater. Don't lose sight of some previous strategies actually that contain some real gold, and let ourselves continue with those and see them through. So, and really, I guess the primary point is, for me, the pathway of benefits must lead to the pathway towards inclusion. Presentations like these are always difficult because if you know human brain, I'm a yellow thinker. So trying to give some facts and figures and also be organised is a challenge. But my plan today is to land somewhere in the middle between aspirations and the achievable. So hopefully I'll do that. And now I must remember to push the button. Okay, and that didn't work. That one. Okay, but first the ad break. Catherine has done a brief introduction and I thought I'd get in early in case I ran out of time. The organisation, as Catherine has introduced, the business that we're in, our vision is that all persons with disabilities reach their full potential. This is Michelle, by the way. She works is one of my colleagues, one of the team. Our values are aroha ki te tangata, making it happen, integrity and excellence. Okay, end of the ad break. Okay, the measure of a nation, a society, a community is in how it treats its most vulnerable members. Who said this? If you said Churchill, Gandhi, Dostoevsky, and he was going to struggle with that one, Truman, Hubert Humphrey or the Bible, then they're all right, because they've all been credited with a version of this kōrero. It's possibly not the first time you've heard it during this conference either. Because providing a welfare system, a support system, is one of the ways our nation treats its most vulnerable people. And whether we realised it or not, in doing so we've taken our first step towards inclusion. But what is the purpose of the welfare system? What is it trying to achieve? These are among the questions for the Welfare Working Group. Well, my proposition is that for disabled people, the welfare system, along with other support systems across government, is community inclusion. And as I said in my introduction, the pathway of benefits is the pathway that leads to community inclusion. In the last decade, activity in the disability sector, I believe, has been quite staggering. I've often reflected on the parallel journeys of Māori and disabled people and found the similarities and differences interesting, but that's not the focus of today. The 2001 New Zealand Disability Strategy was a major landmark for disabled people in this country. The strategy successfully gave true voice to disabled people, and their vision was and is for a society that highly values our lives and continually enhances our full participation. Community inclusion was articulated in this overarching government strategy. In terms of barriers, attitude was identified as the major barrier that operates at all levels of daily life in the general population. Attitudes present as stigma, prejudice and discrimination. Objective 4 relates specifically to opportunities in employment and economic development for disabled people. And while the pathways off benefits shouldn't only lead to more benefits, I do want to mention Action 16, which is to review income support provisions to ensure they provide an adequate standard of living for those who have long-term needs. This is Aloha. In September 2001, a pathway was born. The government stated its direction for vocational services for disabled people in a strategy called Pathways to Inclusion. Following hard on the heels of the New Zealand Disability Strategy, Pathways to Inclusion was significant in many ways. The two primary objectives were to increase participation for disabled people in employment and in their communities. 6 actions form the basis of the directions of that time. Fast forward 7 years to March 2008 and the final evaluation of Pathways to Inclusion by the Ministry of Social Development. Time doesn't permit me yet to outline much of the detail of the results of the evaluation, but I'll summarise in this way. Pathways to Inclusion achieved equity-based legislative change and appears to have been a catalyst for service development in the disability sector. Secondly, although the findings are indicative only, because as with the majority of evaluations, there are always limitations and constraints. Despite this, the objectives, measures and results ought to inform future policy development so that we use our limited resources effectively to build on those successes. At the same time, to focus on areas that we have not achieved as much as we would have liked, and yet are still very important to disabled people. For example, improving the individualised nature of support plans, and I would add to that in particular for people with intellectual disability and those with high support needs. Finally, we must continue to build our understanding of the key drivers, both for the positive change we want to effect, and also for what creates the results we don't want to see. How do we make sure disabled people are not further marginalised by the stuff we do? So, for example, it would be interesting, and I think of value, to evaluate again in 5 years and also again in 10 years' time the off-benefit and declaring earnings measures built into Pathways to Inclusion that would give both a longer-term view and also span the shifts in the local and global economies.